Alice Torres, as I said, Middletown resident and also Director of Early Head Start and with ACE's Area Cooperative Educational Services as well. Briefly, in terms of, there's so much to frame my question. I think I just want to make a statement that in terms of looking at our Early Head Start and our Head Start systems in Middlesex County and statewide, what's really important for, I think, the federal government to understand as well as the state government is that systems are developing and are in place. And those systems include health that you've heard about, the community health center, access to healthcare insurance, access to early literacy programs, access to Even Start, access to work and training programs. All of these things are essential elements for having an effective, comprehensive system of Head Start and early Head Start services. And we have just really start to see the benefits of people coming together and building bridges and working on budgeting priorities that serve our children first. And having said that, I think it's really critical that we feel, rather than feeling distressed and distraught and depressed at this point, we have to be energized, we have to be focused, we have to be purposeful, and we have to be action-oriented and get our voices heard. And I appreciate the comments of our Middletown Board of Ed public school teacher union representative who has demonstrated the commitment to having participated in ways to solve this problem before they became big problems. Middlesex County is wonderful at doing this. It is incredibly energizing just to be a part of Middlesex County's work on behalf of children. Quickly, I just want to make a point about the Early Head Start initiative that has happened federally. We had the major funding initiative with the ERA investment, primarily in Connecticut in Early Head Start. We saw our Early Head Start slots grow dramatically. 407 families were getting served in Early Head Start prior to the 2009 investment of ERA funds. At present, we have another 309. It almost doubled Early Head Start investment. Early Head Start partners with Even Start and partners with other programs, all of which are essential to continuing this investment. Dollars that came to Middlesex County alone, $1,389,066. That was an investment to serve 70 families in Middlesex County. We got this money, we didn't know it until January. We got people, we got the program organized, staff hired. You have heard from Tawana and Carmen Feliciano, another Early Head Start staff member who's here. We had people hired within 6 months. We got the program started. Families started to be served in June. And now in February, we are almost to our full enrollment. We have made incredible strides. This investment will be lost if the ERA money does not continue. So my question in all of this is, help us, direct us as to what we need to be doing, who we need to be talking to. We have an initiative on Monday at the Legislative Office Building to talk about the importance of Head Start and Early Head Start, and your congressional staff members as well as other congressional staff members will be there. Help us know where we need to go.
Well, first of all, let me just say to you, thank you for your commitment and passion and purpose, and you said it absolutely correctly. But I will tell you, ARA funds are no longer. ARA was for 2 years.
We know that.
ARA is over, so it's a cliff. You know that. You know what can prevent that? Well, certainly not the kinds of things that we've been talking about. I am with you. You don't stand on the sidelines and wring your hands saying what I'm going to do. You go up and find out who's throwing the bodies in the water here, and that's what is done. You can shut the place down. Make the phone calls. Get on. I'm serious, but it's not only here. You've got good folks in Connecticut who are with you in terms of the congressional delegation. But you got to be on the phone to them. You got to be their offices. You've got counterparts in other states. You have got to make the weight of whether it's community health, whether it's early Head Start, whether it's Even Start from around the country, have got to make their voices heard. You've got to stand up. I said this to the folks at Wesleyan this morning. Around this table from all parts of the country, probably a lot of lawyers in the room, you have standing. They'll listen to you. You get up and you talk, you bring your parents, you bring your kids, you do what you need to do to let people know that this is at risk, their kids are at risk, and You can get up and do a press conference on your own. You don't need me to be there to do it. You know, I'll be there with you, but my colleagues around the country, you know, will be there as well. We do not wanna see this happen. So the word has gotta get out. You know, years ago I was engaged with an effort, which was when there were a number of folks who wanted to do in the school lunch program. End the school lunch program. We had a nationwide campaign. The Congress received 20, 30,000 white paper plates saying, don't touch my school lunch, don't end the school lunch program. Today we have a school lunch program. We have it. The institution works, yes, with good people on the inside who want to try to do something, but it's the external pressure that make people understand what's at stake. My friend here, Reverend Wynn, said the time is now. The Senate takes up this bill in a few days. In a few days. But it's not the end of the battle. It is, and that you gotta get out there, because the only extension that there will be, if there is one, it will be for 2 weeks or 3 weeks. So this is an ongoing battle which you need to engage.
Thank you.